Hey you guys, welcome back for another week of Work It Out Wednesday. This week we covered sensorineural hearing loss versus conductive hearing loss. And on the previous video, I went through, showed you how to do the Weber versus the Ryan testing exam for hearing loss. And so, I always come back through with some practice questions to test your knowledge. So let's do a couple today. The first question states, Miss Shepard is a 42-year-old female who presents today with complaints of difficulty hearing in her right ear. After completion of the nurse practitioner's assessment, she documents the Weber test results that the patient states that the sound lateralizes to the left ear. What would be the best diagnosis for these findings? All right, I'll give you a minute. Y'all think about what you have. Post your answer in the comments. Tell me what you got. All right, so I always tell you guys to read the stem of the question first. The stem of the question, reading that allows you to slow down for a moment and to ensure that you're answering what they're truly asking you. All right, so the stem states, what would be the best diagnosis for these findings? I always tell you guys when they're asking you or the diagnosis, the best diagnosis, take a moment, go back, look at the scenario, and see what the presentation of that patient is, because we need to see what our potential differential diagnosis could be. So here you have a 42-year-old female who's presented to your office. She's having complaints of issues with hearing in that right ear, right? As you do your testing to try and see what type of hearing loss she may potentially have, the Weber exam shows that she states she's having lateralization to that left ear, right? So then I want you to think about what that means. When we're thinking about the Weber test and the sound lateralizing, we already know that that's abnormal, right? Because the sound should not lateralize at all. They should hear equally in both ears when you conduct your Weber exam. So now that we know it's abnormal, one, you can take out C as a normal finding for your answer, but also just simply, if we know that the sound lateralizes to the left ear, now that makes you think, all right, so she's complaining about the right ear, the sound is lateralizing to the left. All right, so your answer choice will be A, sensorineural hearing loss, because remember, if it lateralizes to the unaffected ear, so the ear that they're not complaining about having any problems with, then that's sensorineural, right? Now, if it lateralizes to the affected ear, the ear that they are complaining of, that's conductive hearing loss, because there's something blocking that sound wave conduction. Okay? All right, let's go to the next question. This question states, a 33-year-old male presented to the office today with complaints of hearing loss to the left ear. Upon assessment, it is noticed that the bone conduction is greater than air conduction to the left ear. Based on these findings, how should the nurse practitioner diagnose? All right, give you a moment. Put your answer in the comments for me. All right, you guys. So again, stem of the question. The stem states, based on these findings, how should the nurse practitioner diagnose? All right, again, when we're trying to diagnose, look and see how the person presented to you. So this 33-year-old male is having issues with hearing loss. His issues are with the left ear. You're doing your exam. This Ryan exam has shown bone conduction is greater than air conduction to the left ear. So then you need to think about, what is this, normal or abnormal? And it should let you know this is abnormal, because you know that it should be air conduction should be greater than bone conduction, right? So AC is greater than BC. That's the normal finding. So we know this is abnormal because here it states that the bone conduction is greater than the air conduction. All right. And then it's at the left ear also. So that's the affected ear. That's the one that they are complaining about. So this is conductive hearing loss. Okay, so the answer is B, conductive hearing loss. Again, go check out that last video where I explain. It'll show you how to do the Weber and Ryan, Ren, whichever one however you pronounce it. It shows you how to do it with the tuning fork. It also explains the abnormal versus normal. So if you had some trouble with these, go check that out so it can help you out. Also, if you find these helpful, please like, comment, subscribe, share with someone who also may find it helpful, and meet me back here next week. All right, bye y'all.